Hello everybody and welcome to my channel. I'm Mariah. Today's topic is borderline personality disorder, or BPD. This topic was suggested to me. In this video, I will cover everything about borderline personality disorder. This video is research based. For the research in this video, I used two different articles to gather information for this topic. The first article was titled Borderline Personality Disorder from the National Institute of Mental Health website. Overview. Borderline personality disorder is an illness marked by an ongoing pattern of varying moods, self-image, and behavior. These symptoms often result in impulsive actions and problems in relationships. People with borderline personality disorder may experience intense episodes of anger, depression, and anxiety that can last from a few hours to days. Signs and symptoms. People with borderline personality disorder may experience mood swings and display uncertainty about how they see themselves and their role in the world. As a result, their interests and values can change quickly. People with borderline personality disorder also tend to view things in extremes, such as all good and all bad. Their opinions of other people can also change quickly. An individual who is seen as a friend one day may be considered an enemy or traitor the next. The shifting feelings can lead to intense and unstable relationships. Other signs and symptoms may include efforts to avoid real or imagined abandonment, such as rapidly initiating intimate, which can be physical or emotional relationships, or cutting off communication with someone in anticipation of being abandoned. A pattern of intense and unstable relationships with family, friends, and loved ones, often swinging from extreme closeness and love or idealization to extreme dislike or anger, which is devaluation. Distorted and unstable self-image or sense of self. Impulsive and often dangerous behaviors such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. Please note, if these behaviors occur primarily during a period of elevated mood or energy, they may be signs of a mood disorder, not borderline personality disorder. Self-harming behavior such as cutting, recurring thoughts or suicidal behaviors and threats, intense and highly changeable moods with each episode lasting from a few hours to a few days. Chronic feelings of emptiness, inappropriate, intense anger or problems controlling anger. Difficulty trusting, which is sometimes accompanied by the irrational fear of other people's intentions. Feelings of dissociation, such as feeling cut off from oneself, seeing oneself from outside one's body, or feelings of unreality. Not everyone with borderline personality disorder experiences every symptom. Some individuals experience only a few symptoms, while others have many. Symptoms can be triggered by seemingly ordinary events. For example, people with borderline personality disorder may be angry and distressed over minor separations with people to whom they feel close, such as traveling on business trips. The severity and frequency of symptoms and how long they last will vary depending on the individual and their illness. Risk factors. The cause of borderline personality disorder is not yet clear, but research suggests that genetics, brain structure and function, and environmental, cultural, and social factors play a role, or may increase the risk of developing borderline personality disorder. Family history. People with a family member, such as a parent or sibling with the disorder, may be at higher risk of developing borderline personality disorder. Brain factors. Studies show that borderline personality disorder can have structural and functional changes in the brain, especially in the areas that control impulses and emotional regulation. But it is not clear whether these changes are risk factors from the disorder or caused by the disorder. Environmental, cultural, and social factors. Many people with borderline personality disorder report experiencing traumatic life events such as abuse, abandonment, and adversity during childhood. Others may have been exposed to unhealthy, unvalidating relationships and hostile conflicts. Although these factors may increase a person's risk, it does not mean that the person will develop borderline personality disorder. Likewise, there may be people without these risk factors who will develop borderline personality disorder in their lifetime. Treatments and therapy. Borderline personality disorder has historically been viewed as difficult to treat, but with newer evidence-based treatment, many people with borderline personality disorder experience fewer and less symptoms and an improved quality of life. It is important that people with borderline personality disorder receive evidence-based, specialized treatment from an appropriately trained provider. Other types of treatment or treatments provided by a doctor or therapist who is not appropriately trained may not benefit the person. Many factors affect the length of time it takes for symptoms to improve once treatment begins. So it is important for people with borderline personality disorder and their loved ones to be patient and receive appropriate support during treatment. Test and diagnosis. A licensed mental health professional such as a psychiatrist, psychologist, and or a clinical social worker experienced in diagnosing and treating mental disorders can diagnose borderline personality disorder by completing a thorough interview, including a discussion about symptoms, performing a careful and thorough medical exam which can rule out other possible causes of symptoms, asking about family medical history, including any history of mental illness. Borderline personality disorder often occurs with other mental illnesses. Co-occurring disorders can make it difficult to diagnose and treat borderline personality disorder, especially if symptoms of other illnesses overlap with the symptoms of borderline personality disorder, and may be more likely to also experience symptoms of depression, bipolar disorder, anxiety disorder, abuse disorders, or eating disorders. Seek and stick with treatment. NIMH funded studies show that people with borderline personality disorder who do not receive adequate treatment are more likely to develop other chronic medical or mental illnesses and less likely to make healthy lifestyle choices. Borderline personality disorder is also associated with a significantly higher rate of self-harm or suicidal behavior. Higher rate of self-harm and suicidal behavior than the general public. People with borderline personality disorder who are thinking of harming themselves or attempting suicide need to get help right away. And I say that with the utmost seriousness. If you or someone you know is in crisis, please call the toll-free National Suicide Prevention Hotline at 1-800-273-TALK or 8255, or text the crisis line at text hello to 741-741. Both services are free and available 24 hours a day, 7 days a week, and all calls are confidential. The treatment described on this page are just some of the options that may be available to a person with borderline personality disorder. Psychotherapy. Psychotherapy is the first line of treatment for people with borderline personality disorder. A therapist can provide one-on-one treatment between the therapist and the patient, or treatment in a group setting. Therapy-led group sessions may help teach people with borderline personality disorder how to interact with others and how to effectively express themselves. It is important that people in therapy get along with and trust their therapist. The very nature of borderline personality disorder can make it difficult for people with this disorder to maintain a comfortable and trusting bond with their therapist. Two examples of psychotherapies used to treat borderline personality disorder include dialectical behavior therapy, or DBT. This type of therapy is developed for individuals with borderline personality disorder. DBT uses concepts of mindfulness and acceptance, or being aware of and attentive to the current situation and emotional state. DBT also teaches skills that can help control intense emotions and reduce self-destructive behavior and improve relationships. And then the other psychotherapy that is used is called cognitive behavioral therapy, or CBT. This type of therapy can help people with borderline personality disorder identify and change core beliefs and behaviors that underlie inaccurate perceptions of themselves and others. CBT may help reduce a range of moods and anxiety symptoms and reduce the number of suicidal and self-harming behaviors. Medication. Because the benefits are unclear, medications are not typically used as the primary treatment of borderline personality disorder. However, in some cases, a psychiatrist may recommend medication to treat specific symptoms such as mood swings, depression, and other co-recurring mental disorders. Treatment with medication may require care from more than one medical professional. Certain medications can cause different side effects in different people. Talk to your doctor about what to expect from a particular medication. Other forms of care. Some people with borderline personality disorder experience severe symptoms and need intensive, often inpatient care. Others may use some outpatient treatments, but never need hospitalization or emergency care. Therapies for caregivers and family members. Families and caregivers of people with borderline personality disorder may also benefit from therapy. Having a relative or loved one with the disorder can be stressful, and family members or caregivers may unintentionally act in ways that worsen their loved one's symptoms. Some borderline personality disorder therapies include family members, caregivers, and loved ones in the treatment sessions. This type of therapy helps by allowing the relative or loved one develop skills to better understand and support a person with borderline personality disorder. Focusing on the needs of family members to help them understand the obstacles and strategies for caring for someone with borderline personality disorder. Although more research is needed to determine the effectiveness of family therapy in borderline personality disorder, studies of other mental disorders suggests that including family members can help in a person's treatment. Finding help. More information about finding health care professional or treatment for mental disorders in general is available on our Help for Mental Health webpage. Tips for families and caregivers. To help a friend or relative with the disorder, offer emotional support, understanding, patience, and encouragement. Change can be difficult and frightening for people with borderline personality disorder, but it is possible for them to get better over time. Learn about the mental disorders, including borderline personality disorder, so you can help understand what the person with the disorder is experiencing. Encourage your loved one who is in treatment for borderline personality disorder to ask about family therapy. Seek counseling for yourself from a therapist. It should not be the same therapist your loved one with borderline personality disorder is seeing. And the second article that I read was called 15 Things You Shouldn't Say to a Person with Borderline Personality Disorder. And this is from the Mighty website. And the words you're going to hear below is actually a person that has borderline personality disorder. And she's also the person that wrote this article. Her name is Nicole Brooks. And she's the writer of this article who has borderline personality disorder. Below is a list of things Nicole and other people with BPD have heard that was not helpful and can be damaging. Avoid using these phrases when talking to people you love who do struggle. Number 1, you're so emotionally unstable. Number 2, why can't you hold down a relationship? Number 3, you don't need to get so angry all the time. Number 4, pull yourself together. Number 5, you are so stupid you spend all your money without thinking about the consequences. Number 6, it's like you have 2 completely different personalities. Number 7, stop being so paranoid. Number 8, don't you think first about your actions? Do you ever think first about your actions? Number 9, you're crazy. Number 10, what caused that disorder? Number 11, there is something seriously wrong with your brain. Number 12, I can't cope with you and your mood swings. Number 13, why don't you have your future figured out already? Number 14, it's all in your head. And number 15, be more positive. And she expands on each one of these points, points on this list, all 15 of them in the article, but I didn't want to make this video too long because it's already long enough, so you can read the article just to see her viewpoint. If you think that you have BPD or any other mental health issue, you should see a GP, which is a general practitioner, preferably one that you know and trust. This is Nicole's point at this point I'm about to say. In my experience, some GPs are more understanding than others. So if you already have a good relationship with one, you should definitely try and speak with that one. I hope you enjoyed this video. As always, I'm open to any suggestions you have for any future video topics. Please let me know what they are in the comment section below or on my Twitter page. And my Twitter handle is at @BurleyMarin. I can spell it for you. At BURLEYMARIH. So it's my last name then my first name. The next video is going to be on sign language, and this was decided through a 2-day poll on my Twitter page. I hope everyone's continuing to stay safe. I will post my notes in the comment section for anyone who needs them. Please like, share, and subscribe if you want to and found this video to be helpful. Feel free to share this video with anyone you think might need it. If you want to be notified when I do any live streams or upload any new content, you're going to want to click the bell icon. And under the bell icon, you're going to want to select the all options. As always, I keep my mistakes in these videos just so you can see how hard it is and how hard I try to get this content out. And I'm sorry for any mistakes you hear, but I do always try my best. And I know that people are struggling, people that don't like my mistakes. I mean, some of them put up with it, but I just keep them in there because I want people to understand I'm a human. I do have pronunciation issues and trouble with reading on camera because of a wound from my past. So I try my best in these videos. Thank you guys for watching. I love you guys. Bye.